Guys, look at this question that they have asked here. Significance of C-reactive protein. C-reactive protein. They're not asking what it is. They're asking why is it significant? What is the significance of the C-reactive protein? Okay, they've asked for 3 marks. Let's try to write around 6 points, let us see. Okay, quickly we have to write. So what is C-reactive protein? How do we know it? We know it only by lab test, right? So look at this lab test, guys. So here you can say C-reactive protein. They are checking in the serum, that is in your blood, and the unit that they are giving in this lab, at least the unit they're giving in is mg per deciliter. It is high, they are saying. Okay, they have put it in red and they've said, okay, it's high. So what they are considering high, if it is greater than 5, then they are saying it is high. Okay. Normally in you and me everywhere, if there is no any inflammation in our body, it will be less than 1 only. Okay. So this is what we know about C-reactive protein, correct? But what is the C-reactive protein? Did we try to understand it? So here you have your liver. Okay, this liver is the one who is making your C-reactive protein. Okay. So please understand this. C-reactive protein, your liver, my liver, everybody's liver makes. And it will be less than what? Less than 1 mg per deciliter. Okay, in you and me, everyone. Now, but let us say somebody has some inflammation. Inflammation. I think inflammation. Okay, now this inflammation, it will give a interleukin 6. Okay, this inflammation is releasing interleukin 6. That will make the liver release the CRP in more quantity. More CRP will get released. Okay. So it will become greater than this, it will become more than 1. So if they are saying more than 5 it is becoming, then it is significant according to that lab. Now this is CRP, so it is indicating that somewhere in the body there is inflammation. Till here did you get? Now what is the significance of the CRP? Means it is not just that it is indicating inflammation somewhere in the body. Also the CRP now goes to this inflammation. Okay, wherever that inflammation was. So somehow we will connect this with. So the CRP will come here. Okay, the CRP guy, come here. The CRP will go here. And what it will do to this inflammation, it will increase the immune response. It will increase the immune response to tackle this inflammation. It will do, if there is bacteria, it will opsonization, it will do, it will phagocyte, help the macrophages to phagocyte this bacteria. So if there's infection which is causing this inflammation, that time also it will help. Also, one more word you have to write. Complement system it will activate something. So to basically, the CRP is not just that it is getting released and you're measuring it as a lab value. No, it is also helping to decrease this inflammation. Inflammation itself is triggering the CRP release. CRP is also going and helping this inflammation. Did you get? So that is the significance. Okay. So now this lab value we have checked. So basically this is a non-specific marker. Non-specific marker means what? You don't know where the inflammation is, what is the condition, but you know that somewhere in the body there is inflammation. It is a non-specific marker. It can mean so many things. Also, it is there's one more word you have to write. It is an acute phase reactant or protein. Acute phase protein, I think. Acute phase protein. Acute phase protein. That means whenever this starts, CRP is increasing. So what you should understand here is one more thing. Basics we will tell you of before we go to the textbook theory. So CRP, you cannot do diagnosis as such that, okay, this is the issue. It is one of those non-specific markers. It is mostly used in monitoring your progress. If CRP is going on increasing, that means whatever you're doing is not helping that person. You understood? CRP should go on reducing once you start the treatment. So for monitoring, they are telling it is good. Okay. So look at this one diagram. See, this is surgery. Now, when surgery has happened, the CRP, what is happening? If there's infection, the CRP is going on increasing. See, CRP had to go up and go down after the surgery. This is normal. What they are saying is, normally if somebody has had a surgery and everything is going fine, the CRP will increase and then go on decreasing. But if after surgery there's an infection in that person, right? In that person there's an infection, then CRP will go on increasing. So then you'll have to treat the infection. Then it will come down. Okay, CRP has to come down. So this is post-surgery. They are saying how C-reactive protein will help you. This is one of the importance. You understood, right? So now let's get started with this video. Whole logic you have understood, right? Look at some diagrams also here. So liver is here. Liver is making the CRP. Who is instigating it to make it? Who's the trigger? Interleukin 6. From where is interleukin 6 coming? From the inflammation, right? And then what the CRP does? It goes back and it makes sure that this inflammation gets controlled. Some other people also make CRP, guys, not just liver. Mainly it is liver. And one more thing you have to notice here. If you are noticing here, why did they put heart here? If CRP is high, they are saying that it is a risk for it's a cardiovascular risk. It's not good for your heart. That's what they're saying. Okay. Too much information. But this is biochemistry. Okay. You have to learn, and they have asked it in medicine exam. We will write the answer now. So what does the CRP do? It increases the cytokine release, phagocytosis, it will increase opsonization. That word opsonization. Macrophage will opsonize, phagocytose this. Then chemotaxis, autoimmunity prevention, damage cell, something that okay, I'll tell you one more diagram. So here you have the liver. Liver is releasing the CRP that they are showing in pentagon shapes, right? Most of the people are showing the CRP as pentagon. Now that what it is doing, opsonization of pathogen, complement activation, pro-inflammatory effect, phagocytes activation. Okay. Some people are measuring this per liter and about 10 milligram per liter. Some people are saying, okay, just check your blood report, what it is per liter or deciliter. So now get started, write this in the exam, draw the diagram so that if you draw the diagram, you will also understand which diagram we expect you to draw. Liver releasing CRP because of inflammation. I'm drawing the same thing again and again, is it? Interleukin 6. And then you will say that the CRP will go and do something for the inflammation. What will it do? Phagocyte opsonization, complement activation, some immune response it will increase. Something and all, everything else you write. Okay. Okay. This diagram, if you draw off, you will get good marks, I think. Okay. Now, what is CRP? CRP is a acute phase reactant or acute phase protein. There are so many other acute phase proteins. This is the most important one. Okay. It is released by whom? By the liver. It is, when will it increase the levels? When there is inflammation in the body. Who is triggering this? The interleukin 6. How can you check your CRP levels? By a sample blood check. What is the normal level in anybody? It is less than 1 milligram per deciliter. If it is more than 10 milligram per liter, the labs are saying that it is significant. Okay, textbook is saying per deciliter. This is the normal. Labs are saying per liter. If it has increased so much, then it is significant. You understood, right? This is a non-specific marker. You cannot specify which condition is causing this issue. When will you check all this? Whenever you suspect any fever in people, inflammation, even neoplasm, right, that is cancer, anything that can cause an inflammation, especially they are talking more about rheumatoid arthritis, remember, if there is any tissue injury, necrosis, infection, neoplasm, so basically it is non-specific. You are getting it? You cannot say why it has increased. That it will not tell you. That's why we are telling you, use it more for monitoring. So post-surgery, we told you, right, post-surgery also they will use it to monitor whether there's infection developing or not. CRP should come down, right? It will elevate and then it will come down after some days. A high, okay, so in SLE, they are saying that CRP will be normal. In SLE, that is systemic lupus erythematosus, CRP will be normal, but ESR will be elevated. They're saying, just to tell you that SLE, CRP will be more normal. Don't think it is SLE, something like that. CRP is a check of the something in your blood, correct? The blood test. So it doesn't depend on whether you have anemia or polycythemia. However, when you talk about ESR, ESR is what? Erythrocyte sedimentation rate. You will put the blood into a tube like this, right? You take a tube like this. Tube like this you will take, and into the tube you will fill blood, right? And you will check how soon it will sediment. You'll just let it stand and you'll see how soon it will sediment. This is affected by the number of RBCs inside. That is, this test ESR is affected by anemia, polycythemia, that is less RBC, more RBC. By all this, it will affect, right? More RBC, it might sediment sooner. So ESR is very dependent on other things. So ESR is not a great thing. So they are saying CRP is a better thing because it is not influenced by the number of RBCs, etc. in the blood, right? So they are praising CRP over ESR. Then they are saying that there is something called as high sensitivity CRP. High sensitivity CRP means what? At that deciliter level they are checking, I think. Okay, if even a little rise in the CRP, they are saying that you can know whether this person is at risk for heart attack or something like that. Some cardiovascular risk it suggests. That's what they are saying. So you have to write this point also in the exam. High sensitivity CRP is used to check cardiovascular risk. Okay, next. Continue your theory part. Before that, one Gyan, we will see which are the other acute phase proteins. So they're telling that alpha-1 antitrypsin, ceruloplasmin, C-reactive protein. Okay, C-reactive protein is the one we are talking about. Which are the others? Ceruloplasmin. Okay, and I'm thinking this is alpha-1 antitrypsin only. And the most important one is which one? C-reactive protein. This is what you have to say. The major component in acute phase proteins used for evaluation of acute phase responses, CRP, C-reactive protein. Okay. Now, one more thing is you can think here, if person has protein deficiency, can he make this acute phase protein? A lot of it? That is a question mark, right? So, normal people will make, I'm thinking, if there is an inflammation. Okay, one more thing now let us see is the significance. We went to significance, right? Now, in theory part we will write. So, it is going to activate the complement system, enhance the phagocytosis, that is opsonization word they are looking for. Macrophages will do the phagocytosis, by the way, and modulates the inflammatory response by interacting with immune cells. So, it's trying to build your immunity. Inflammatory response. But if it is an autoimmune condition, what will it do to the immune system? Will it increase it or decrease it? Because somewhere we saw that it decreases it, right? But somehow this is the significance. It will go and actually get released by this inflammation and go to tackle this inflammation itself. Okay, that much you have understood. Then, do you know why it is called C-reactive protein, guys? Okay, now let us look at why it is called a C-reactive protein. C stands for copolysaccharide or C polysaccharide or something. So when this, we told you, right, this C-reactive protein, what it will do, it will go and bind to the bacteria. So it is not just that it will get released and come in your lab report as a result. No. If there's bacteria there, you can see here they have shown some bacteria. Like we told you, the C-reactive protein, always they are drawing in in pentagon shape like this. So what this one is doing, it is going and attaching to the bacteria. You can see here the bacteria. I will put one bacteria. I have bacilli. They have put here in this diagram. So it is going and attaching to this bacteria. Bacteria. This is CRP. Okay. So it has got attached. So this bacteria has a cell wall, right? Bacteria can have a cell wall, right? Now that cell wall will have a C polysaccharide in it. That's some sugar, right? Polysaccharide means C polysaccharide. So the C is coming from there. So the reactive protein, this protein went and reacted with the C polysaccharide. The protein which the liver released went and reacted with the C polysaccharide of the bacteria. Hence it is called a C-reactive protein. The protein which reacts with the C polysaccharide. Very good. So that's all we wanted to cover in this video. Some people are saying that it is binding to the phosphocholine. Some people are saying it is binding to the C polysaccharide on the cell wall of the bacteria. Okay, so phosphocholine also, this image also says phosphocholine, okay. So here what they are showing in this image, same thing they are saying, there is bacteria here. Then interleukin 6 is released because from the macrophage. That will go to the hepatocyte. Hepatocyte is releasing the C-reactive protein. The C-reactive protein is going back here and binding to the bacteria and taking these bacteria near the macrophage, and the macrophage will phagocyte them. Opsonization it is enabling. What is opsonin? Let's check this word meaning. That word is very important, guys. Opsonization means it is binding to the bacteria, right? That one. So it is coating the pathogen. It is coating this foreign particle so that it is susceptible by the phagocyte, that is the macrophage. So opsonization means you are making the bacteria more yummy to be eaten. So you are opsonizing the bacteria. You are making the bacteria coated so that it will be more yummy for the macrophage to eat. You are sugar coating the bacteria. Okay, that is the opsonization. Great, we have seen the significance of C-reactive protein. Bye-bye.